हेलो गाइस, वेलकम बैक टू न्यू वीडियो ऑफ मेडिकल मैनेजर चैनल। तो मेरा नाम है आकाश। तो आज हम बैठे हैं रात के 2 बजे GGH, दैट इज़ गवर्नमेंट जनरल हॉस्पिटल। जगह नहीं बताने वाला, ठीक है। तो आज के इस वीडियो में मैं बताना चाहता हूँ कि व्हाट आर योर रेस्पॉन्सिबिलिटीज डूइंग अ नाइट ड्यूटी इन अ रिमोट विलेज। ओके, so one of the major thing is responsibility. Okay, you should be very much responsible and you should take that responsibility for whatever is happening. Okay, so for example, at night time many patient will come like some random shit. Okay, so many MLC you need to do at night time. So Aditya, what do you feel like, what all MLCs we will get?
We just used to study about the cases like scorpion sting, dog bite, RTA, assault, burns, snake bite in the books itself, but we have to face these in the emergency ward or casualty in real life, and we have to manage them. We should know the dosage, the IM. Sometimes the brother or sisters may not be available, so we must be thorough with these common cases. At least poisoning cases might be there. OP
Poisoning, OP poisoning.
OP poisoning.
Many actually I have seen only hardly 4 cases of OP poisoning in our side. Okay, but here like OP poisoning is so common. Like every year and then they will try to suicide by drinking OP poisoning. Okay, so it should be on tongue like need not. One more thing, OP poisoning drug of choice is atropine and pralidoxime. Okay, so when the patient comes here, rarely, like it's not 100% necessary to give 100 atropine and pralidoxime. Okay, but in bookish language it is very much that only, but here only symptomatic treatment is given for OP poisoning. Then at last, like patient is like bradycardia deteriorating, then only treatment is given. This thing you will learn, like practical things will come when we are here. Okay, and this one is about MLC. How to write MLC, like what all MLC will gun, when will the police come, what all we should do?
First thing is, if the patient is critical, you should refer the MLC to some other intern or some other person. You should treat the patient.
Okay.
If the patient is stable enough, you can just do simultaneously.
Yes,
you can book the MLC, write the details of the patient. Most important is take the sign of the attendee.
Yes.
Or the attender, right? That is most important. If you don't take the sign, then the blame will be shifted to the duty doctor or the intern. That's important.
Yes. First thing, like we should first is our treatment. Our thing is to treat the patient. Okay, so whenever any MLC case comes, first thing, treat the patient, make him stable, keep him alive. Then everything is fine. Then give the police intimation. Okay, police intimation form will be there. You need to call the police. Police will come and take every details. Okay, do your part. Leave the rest part to police. Like why he drank OP poisoning. Why that why things is not ours. Okay, ours is treat the patient. Why thing is of police. Okay, so he will decide. So next thing, like what all achievements we can do in this hospital is, one is we can put the IV cannula. We will learn about drug doses, like we can put IM, IV injections, and many other things we will learn. Okay, practical knowledge we will gain more here. So one more important thing is majority, like if any patients came with severe pain like chest pain, breathlessness, this thing. Okay, so here more like keeping it as like MI case, like radiant, there's all symptoms, not I won't tell, but any patients comes. Okay, here there is a ECG machine also, and ECG machine is connected to central. Okay, we just need to take ECG Jayadar center. The reports will go to one hospital. There a doctor will see the ECG, write a report, and it will everything happen in just 10 minutes. Okay, you will get a report in 10 minutes. For that, if MI case is there, here loading dose is given. Loading dose is already present. Okay, that is only aspirin, clopidogrel, atorvastatin. These are there. We loading dose will be given and just refer to the hospital. Okay, because as this is GGH, don't take risk. Okay, our duty is not to treat any heart disease, because we are not cardiologist. Don't think you are like neurologist, cardiologist, urologist.
The book is different.
Book is different. Reality is different. Just do whatever you are assigned for. Okay, just basic management. For example, stabilize the patient, refer to the higher center. For example, pain management, like they are having severe pain. Here highest we have given is like tramadol is there. Other than that, here no morphine, no fentanyl, nothing. Just highest is tramadol. If not managing, refer. Okay, here anything which is going out of hand, refer. Anything which is getting complications, just inform the duty doctor. Call duty doctor. Duty doctor should be present every MLC case, every serious case, everything. Okay, and only small things is there, then you can manage. Okay, Aditya.
And most important is handling the patients. The patients will not be same or your usual patients that you see in ESIC in the OPDs. The patients will be drunkard. The patients will be having some other intoxication. So you have to handle the patients properly. You have to talk to them in their own language. You have to console them. You have to make them understand that the treatment is going to be in this way, and this is what they're going to be expecting, right? And they will not be satisfied. Sometimes they want IV. Sometimes they want NS. They in here the layman also knows.
Layman also knows.
NS. They call it glucose. They want glucose is important. But first important is assess. Check the BP. If the BP is too high, don't overload with fluids. It might cause more problems than the problems currently present, right? And you have to assess the patient, then make sure the vitals are stable. And if it only requires, then go with the IV or IM injections or NS. Just don't simply, the patients will say, I want injections. I want everything. They will, if you give more and more and more, the mentality here is that they want injections, and the mentality says here that if injections are given, then only the cure rate is good. Okay, so just follow. If you're in confusion, just consult the CMO. CMO is casualty medical officer, or consult with the duty doctor.
Yes.
And main thing is, don't try to be a hero.
Yes,
That
don't
is,
try to be hero.
that is
you are
very
not
important.
hero.
You are intern.
You are intern.
You're intern.
Okay, you didn't get the license. Okay, you just got a temporary license. Until you get license, keep your legs on the ground. Okay.
I know that many we have studied this that the books are completely different. The real world is completely different.
Okay.
So just don't be hero. Follow normal protocols.
Yes.
And as GZ said, if something is not manageable, just stabilize. Most important is stabilize. Then refer.
Yes.
Ambulances will be there. Just refer.
One more thing. Here the nurses and the group D workers are much more efficient than you. You are like just some 20% of them, okay? Because whatever they are seeing from 5 years, 14 years, 15 years, 20 years is also there, okay? They surely know more than you, okay? Just don't feel attitude. Just ask them to teach you. Ask them to like how it is, why it is. They will surely teach you, okay?